Welcome to your Liposuction Pre Op Teaching video. So before your pre-op appointment, if you were supposed to get any type of clearance for surgery from a primary care or a specialist, make sure you have that in the works. Were you supposed to track down an old EKG or any lab work? You can start working on that as well. You're already watching this video, which is great. Review your paperwork and plan ahead. 2 weeks prior to your surgery, it's important that you stop all blood thinner medications and herbal supplements because those herbal supplements have likely not been tested with anesthesia. Common blood thinners are aspirin, ibuprofen, fish oil, and vitamin E. If you're a regular drinker, it's good to reduce your alcohol use to 1 glass or less a day for the 2 weeks prior to surgery. And if you really care about your liver, you can stop drinking altogether the week before. Review your teaching material and create a specific question list so that we can go over those with you at your pre-op appointment. If your labs and EKG have been done, be sure to bring those with you. So there are a lot of over-the-counter medications that are great to have on hand after surgery. The first is Tylenol, which you'll be taking for pain. Dramamine or Bonine are common anti-nausea medications that are typically used for motion sickness, and these work great after surgery as well. It's good to have antacids around in case you get heartburn, including something like Tums or Pepcid. Antihistamines are also important to have. We would recommend either Zyrtec or Claritin and also Benadryl. Forte is given to you at your pre-op appointment, and this is a homeopathic medication that's used to speed healing by reducing swelling and bruising. It does contain pineapple, papaya, and traces of wheat, so if you have food allergies, please plan accordingly. This is something you want to start the night before surgery, and you can continue it twice a day until it's gone. You'll also be given your prescriptions at the time of surgery, and cross our fingers, someday we may be able to electronically send these to your pharmacy. They will likely include an anti-inflammatory medication, a muscle relaxant, a painkiller, and an anti-nausea medication. Tylenol is what we want you to use after surgery to help with pain. Tylenol comes in 2 strengths, regular strength, which is 325 milligrams per pill, and extra strength, which is 500 milligrams per pill. We recommend that you take 1,000 milligrams 3 times a day for at least the first few days after surgery to help with pain. We don't want you taking more than 4,000 milligrams of Tylenol in a 24-hour period, and this is written on every Tylenol bottle. This is a medication we recommend you start the morning of surgery with a tiny sip of water before leaving for the hospital. Celebrex is an anti-inflammatory medication that I like to describe as designer ibuprofen. Each pill lasts for an entire 24 hours, and it has much less bleeding than the other typical non-steroidal medications, so it's safe to use around the time of surgery. This is a medication you only need to take as needed. You don't need to complete your prescription if you're not having pain. The dose is based on age and kidney function. So if you're under 65 years of age, we recommend you take this twice a day as needed, and you could wean down to once a day as your pain resolves. If you're over 65 years of age, or if you have kidney issues, we're only going to have you take this once a day, or in some patients, we may skip it altogether. So this is a medication we recommend starting the morning of surgery with a tiny sip of water before you leave for the hospital. If you are under 65 years of age, you can restart this 12 hours after surgery, and if you're over 65, we want you to restart this the next day or 24 hours after surgery. Now, this used to be a very expensive medication, and a lot of insurance companies won't pre-authorize it, and we don't pre-authorize it for cosmetic surgery. So if you have the app GoodRx, you can find it cheaply, and I'll just give you a pointer that Costco, it's usually pretty inexpensive. I got mine for under $20 for my prescription. So Valium is a muscle relaxant and also an anti-anxiety medication. This is, if you remember the Rolling Stones song, Mother's Little Helper, this is what they're talking about, because it can definitely take the edge off and make you feel much more comfortable after surgery. You can take one of these every 6 hours as needed. Make sure that you stagger it with your pain medication, because this, in addition to the narcotic pain medication, are sedating. So you don't want to take those two at exactly the same time before knowing if you really need both. Also, don't mix this with sleeping pills or other anti-anxiety medications, including things like Xanax, Ativan, and Ambien. It's also really important not to mix this with THC. We generally do not refill this medication because it can be addictive. Now, your narcotic pain medication is most commonly going to be oxycodone, which is the pain reliever found in Percocet. You can take one of these every 4 hours as needed, and if you are having more severe pain, you can take two at a time, but we don't want you to do this continually. Again, because this is sedating, make sure you stagger it with other sedating medications like your Valium. There are other options available if oxycodone is not a good match for you, including things like Ultram Dilaudid or Norco. Norco is what used to be referred to as Vicodin, and it does have Tylenol in it. It does not come as a version without Tylenol, so you would have to reduce the amount of Tylenol that you're taking, so you're not going over that 4,000 milligrams in a 24-hour period. Also of note, we can't refill narcotics over the phone, so if you're getting low, we can phone in something weaker, but you'll have to come in for a written prescription. Now remember, with narcotics, it's the patient, not the caretaker, that needs to decide when and if this pain medication is needed. Our goals of pain control that you can get up and walk around and breathe deeply, and that you can also get some sleep, but we don't expect it to make you pain-free. It does have a lot of side effects, including nausea, oversedation, decreased respiratory drive, itchiness, constipation, and addiction. We made a big mistake in the past by telling people to use narcotic pain medication to stay ahead of their pain. That's why you're on the Tylenol and the Celebrex, so that you can stay ahead of your pain with those medications and use the narcotic more sparingly as needed. We're also going to give you a prescription medication for nausea called Zofran ODT. The ODT stands for oral dissolving tablet, and all you need to do is place it under your tongue for it to be absorbed. On the day of your surgery, you'll likely also get what's called a scopolamine patch, which looks like a little spot Band-Aid that they'll likely place behind your ear or sometimes on your arm under a piece of sticky saran wrap called Tegaderm. Now, this works for about 3 days, and there are some side effects, including dry mouth, blurry vision, dilated pupil, urine retention, which is pretty rare, but we tend not to give this to men because of this side effect, and confusion, which is much more common in our older population, so we may leave it off for patients that are of a more advanced age. Now, when you're ready to take this off and throw it away, make sure you take a washcloth and wash the skin where it was placed, and also your hands well after removing. And make sure you wrap it in something or put it in a trash can where pets can't get into it, because it could make them very sick if they eat it. Remember the Dramamine and Bonine that you started before surgery? This can also be used for nausea postoperatively. The good thing about all of these medications is they can be used together. So if you start with one and it doesn't work, you can always move on to another. Now, the night before surgery, it's important to understand your NPO orders, and that means when you can last safely eat or drink. So for food and full liquids, which include things like milk, lattes, or orange juice, you need to stop those a full 8 hours prior to your surgery. You can continue to have clear liquids, which include water, Gatorade, apple juice, tea, black coffee, and Jello for up to 4 hours prior to surgery. And if you have the option to take these, I would recommend it. We know patients that have a little sugar in their system and caffeine, if they're used to being on caffeine, will wait wake up feeling better after surgery. You can also start your arnica forte the night before surgery and take your first antibacterial shower with the HibaCleanse soap you were given at your pre-op appointment. There's typically enough in there for 2 full showers, so it should last you for the morning shower as well. Know your arrival time and place, review your instructions with your caretaker so they're not nervous, and know that anesthesia may give you a phone call the night before surgery. Morning of, take your second antibacterial shower and make sure you don't put lotion on the surgical sites, and also maybe not a full face of makeup. Wear easy clothes to the hospital that are easy to get in and out of, like a hoodie and sweatpants. Take your pre-op medications that were recommended with a tiny sip of water before you leave for the hospital. And again, this is typically going to be 1,000 milligrams of Tylenol, 2 of your Celebrex, and a Dramamine or a Meclizine tablet. Now, if you're on regular prescription medications, we will tell you at your pre-op which are important on that day, and honestly, most of them are not important. So we'll try to be very clear about which medications you should take on the morning of your surgery. Bring a form of identification and your garments with you to the hospital, and make sure you have those garments sitting out for me because I have to sneak them back to the OR before you go back. It's not a bad idea to bring a copy of your paperwork just in case something was lost. And if you're staying overnight, remember to bring your phone charger, an extra garment if you purchased one, your arnica forte, and any of the medications that you normally take that are not common, that the hospital might not have on formulary. It is important for you not to bring the pain medications that we prescribed at your pre-op appointment. Once you're home, it's important that you have a caretaker the first night of after your general anesthetic. Sleep in any position that's comfortable for you, and know that liposuction sites are going to drain a lot, so you want to protect your linens and upholstery. Some people like putting trash bags down under beach towels so that if something does drain, you're not leaving a stain. If you don't have a bowel movement after about 4 days from surgery, be sure to use a laxative. You can shower as early as the next day, but we do recommend showering with a friend. Now, when you unzip and take off your garment, your blood pressure is going to drop. So you want to make sure you make these position changes very slowly. You may unzip your garment and sit on maybe the toilet lid for a couple of minutes to make sure you're okay, then stand up for a minute, then get in the shower. You're going to leave the tape dressings on your incisions and everything can get wet. I'll warn you that it's pretty exhausting when you take your first shower, so make sure you've got someone there with you in case you get lightheaded, and you may plan a little bit of a nap afterwards before you go about your day. You are going to have toppy foam, which are these big white pads inside your garment, and we like to orient them so that they are providing smoothness underneath things like your zippers and the edges of the garment, like underneath the breast area where it may end, and you may even use a surgery bra. So you want to span the space between the surgery bra and the top of your garment with another piece of toppy foam. You can also layer other type of garments underneath your surgery garment. Things like Spanx work well, cotton camis can work well. So you can still use your toppy foam, or you can layer something else underneath it. People can stop using their toppy foam anytime they feel that it's not providing the smoothness and that little extra pressure that makes things more comfortable. So you don't need to call our office to ask permission, but we do recommend that you try to keep using it at least through your first follow-up appointment, or about 5 to 7 days. Don't throw them out, because you may stop using them and then realize you wish you had one back again. So keep them for a little while before you decide to toss them. You can open your garment up while you're sleeping or resting if it makes you more comfortable, especially if you feel like that tightness is making it more difficult to breathe. The garments in the foam will get gross and may need to be washed, so that's totally fine to do as well. Restrictions after liposuction are not really that strong. We just don't want you laying around all the time. We want you to be up and moving because that's good for your lungs and good for your circulation. You should sleep in whatever position you're most comfortable in. And as far as activity goes, just let pain be your guide. There's really no restrictions about how much you can lift or what you can do. Compression is a good thing, but not if it's constricting you too much. So just make sure that if your garment is too tight, or if you just need to unzip it at night, it's totally fine. Now, it's normal to have drainage after liposuction, a lot of drainage, and it typically goes on for about 48 hours. It looks bloody, a lot like cranberry juice. There may be some areas that continue to drain even longer than the first couple of days after surgery. There's also quite a bit of pain. People describe it as pulled muscles, a sunburn, and some weird numbness to the skin. Expect to be pretty tired and fatigued. You'll see bruises that may show up several days after surgery, and if you did have J-plasma or Renuvion as part of your liposuction procedure, you may feel some of that trapped gas under the skin that feels like Rice Krispies, and that typically is going to be gone after the first 24 hours. You may also experience some dependent swelling. So that's going to be areas like the genitalia area where the crotchless part of your garment allows for some fluid to get trapped, and that can really be alarming for some people. You may also see a lot of swelling at your tailbone area from laying down and resting after surgery. Your little feet are probably going to look pretty swollen as well. So you can use those white stockings that you left the hospital with anytime your toes start looking kind of like little sausages. Now, you're probably going to see some temporary weight gain of about 5 to 10 pounds, which is just going to look like generalized puffiness, and I promise that will get better after about a week from surgery. It's also pretty common to have some itchiness under your garment. So these are some of the things that are a little more concerning for us. A low-grade temperature of 99 to 100 is not uncommon after surgery, but if it starts creeping up to 100.8 or 101, that can be a sign of an infection, so please give us a call. Also, a rash that starts spreading could be a drug reaction, so it's important to stop your medications, start those antihistamines like the Zyrtec, Claritin, or Benadryl, and give us a call so we can talk to you about this as soon as possible. Chest pain, shortness of breath, or persistent lower extremity pain or swelling that doesn't seem related to the surgery could be a sign of a blood clot, and this could be a medical emergency. A bad headache that doesn't go away after taking pain medication, hydrating, and using some caffeine could be a rare sign of hypoxia or blood oxygen levels that are too low. So we use a pulse oximeter to check you in our office, and these are easily available at pharmacies. Your oxygen level should be 90% or higher after surgery. If it's below 90%, it's a good idea to give us a call at the office. Rarely after a liposuction surgery, you may be sent home with an incentive spirometer, which helps you to take those deep breaths. If you were given one at the time of your surgery, make sure you're getting up over 1,000 mLs. You can start driving once you're off all your pain medications and you're feeling pretty good. So for most patients, this is probably going to be 1 week or less. But use good judgment because your reaction time is going to be slow when you're not feeling 100% and you're healing from a surgery. At your first follow-up appointment, we're going to look at your surgical sites, remove any of the itchy coverall tape that might be on there or anything that's rolling up, go over your medications with you if you're still taking things, and go over your activities. Now, the nice thing about liposuction is we don't have a lot of restrictions, so we're going to make sure that you're moving around a lot, and that if you're overdoing it, we'll just tell you to dial it back a little bit. This is also a good time for us to talk about future scar care options, and for you to bring second stage garments, which you can transition to from your surgical garment. Second stage garments need to cover the whole area that's had liposuction. So if your thighs were included, make sure it goes down further below your knees or to your calves. It's nice not to have bands that cut across the center area of where you had liposuction. If your back or your arms were also done, there's a lot of available garments on the internet that you can also add to your wardrobe. Your second follow-up may be anywhere from 2 weeks to 3 months based on how you're healing. We do recommend that you stay in compression for about 6 weeks post-operatively. Longer is fine, and sometimes people are just so over it they need to stop, and that's fine too, as long as you're not having any problems with prolonged swelling. It's common to have tenderness that may linger for even up to a couple of months post-operatively, as well as some numbness, and this should all continue to resolve slowly over time. Now, with all body contouring procedures, I do recommend people keep track of your weight, because you are magically getting smaller for the several weeks after your swelling is going down. So sometimes people start eating a little bit more and they start to redistribute their weight a little bit. So I do think for at least several months after your surgery, it's not a bad idea for you to check your weight at least once a week. Well, thank you for watching this video. Now you are totally prepared. You can plan ahead, bring in your questions, educate your caregivers, make sure you take the time that you need to heal, and follow your instructions, all for a very uneventful recovery.